think I empower my staff by giving them diverse opportunities and also allowing them to express themselves, having an open door policy, encouraging them to have new ideas, how we can make our patient care better, getting them to step forward, looking for new opportunities for them to increase their skills, increase their confidence, and giving them that ability. I also try and put myself in their shoes. It hasn't been that long that I've been away from the bedside, so I think a lot of the time I can relate to some of the problems and situations that they get into. But having, trusting their instincts and encouraging them to move forward and encouraging them to change as well. We don't always have to stay the same in nursing. There's other ways that things could get done. And just because we've always done it one way doesn't mean that we can't change our system so that we can provide better patient care, excellent patient care to our patients. Being present on the unit. I think people need to see you. You need to be visible. You also need to talk to your staff as well. I wouldn't expect my staff to do anything that I wouldn't do. So if there's something going on in the unit, if we have a race call, if a patient's in trouble, if there's a situation that staff don't know how to manage, I'm out there with them. I don't expect them to be able to manage something that they've never managed on their own, totally independently. So if I'm out there with them, encouraging them, and also looking at different solutions for a problem, I think that helps build trust. I think it's important for all shifts to also see you, right? So I'm usually here fairly early in the morning so that I can touch base with the night staff. I also see the day staff and try and touch base with the evening staff as well. So I think being visible is really important. Having an open door policy, I think, also helps build trust, and it helps build those relationships so that people know that they can come to you and ask questions, ask for suggestions. How would you handle certain situations? Because that's what I've always had. So to me, that's really important that people see me, that I touch base with people every single day when they come on. Is there anything that we can do? And that's how I help build trust within my staff. We're a fairly small unit. There doesn't tend to be, it's more interpersonal conflict as opposed to conflict within patients. I always try and do it in private. I think that's important. Try and get both sides of the stories from each individual or whoever's involved, as well as, can the situation be resolved with the two people? Can I bring them into the room, be a mediator between them? I also ask, have they actually talked to that other person? Because often it's somebody coming in to say, you know what, I worked with so-and-so and they didn't do this. So my first question is, have you talked to that person about this situation? Because oftentimes it's the other person doesn't know that they've even done something wrong or that they've upset somebody. So I always try and do it in private, as well as try and figure it out amongst yourselves first. And if I need to get involved, then we look at, do I mediate? Organizational development sometimes gets involved if it tends to be a team conflict. We can do that. And then we also have our EAP, which is our staff service that we offer to everybody, a counseling service if somebody just needs more counseling sort of on the side as well. And they also help with career building. And we also offer conflicts throughout the hospital on conflict resolution. I try and encourage them to attend education sessions, whether it's within the hospital or outside the hospital. So I try and grant as much education leave as possible. I've tried to bring in more in-services throughout the unit. We have a fairly good educator who encourages and tries to bring extra stuff. But yeah, encouraging people to actually go out there and learn. And I always encourage them to come back and actually teach the rest of the unit as well. So I think any education session people go to, they should be coming back and saying, hey, I went to this education session. This is what they're doing at a nursing home or at another hospital, because that's how we also build our knowledge base with what are other places doing.
And the standards every 6 months at least, you have to have...
The hospital grants all the staff 1 to 2 days of paid education leave per day to attend a conference.
Oh, wow.
And we've got a fairly healthy nursing professional practice department that offers a bunch of courses that people can attend.
For free.
Yep, usually. Or
Okay.
minimal cost to hospital staff. It's one of our core values, so it's one of the pillars of how I expect my unit to run. I don't expect everybody to get along with everybody, but I expect everybody to respect each other. So whether it's helping each other on the unit, whether it's somebody asking you a question to increase their knowledge base, or if they have a situation that they've never run into. So my expectation is that everybody helps each other. Like I said, we're a very small unit, fairly close-knit unit. But my expectation is that people are always going to respect each other and that they're going to support and help each other as well. Trust your gut. I think as nurses, we don't trust our guts enough. Sometimes there's a situation that you run into that you're not sure of yourself, and there's that little voice at the back of your head that's saying, you know what, maybe I should go ask somebody more senior, or maybe I should go ask somebody who's actually had this situation happen to them. Trust your gut. If that little voice is telling you not to do something, then stop, take a breath, go find out, and then proceed or not proceed. But that little voice will never steer you wrong.